I'm Dr. Charbel Salamon, Chief of Urogynecology at Orlando Health and Winnie Palmer Hospital for Women and Babies. Join me to learn more about pelvic floor disorders on this edition of Taboo Topics. Urogynecology, officially known as female pelvic medicine and reconstructive surgery, is a subspecialty of gynecology and urology that is dedicated to the care of women with pelvic floor disorders. Pelvic floor disorders result from weakened pelvic muscles, weakened ligaments, and connective tissue. There are three main conditions within pelvic floor disorders. First, pelvic organ prolapse is the dropping of pelvic organs caused by the loss of normal support. The second condition is bladder control problems, such as urinary incontinence or urinary urgency and overactive bladder. The third common condition is bowel control issues. And this category includes things like constipation and straining, but also accidental bowel leaks and bowel urgency. There are many risk factors that increase the likelihood of pelvic floor disorders, such as pregnancy and childbirth, repeated straining and heavy lifting, genetics and family history, menopause, and prior pelvic surgery, just to name a few. 1 out of 4 women suffer with pelvic floor disorder. These conditions are very common, and it starts as early as women in their 30s and increase in frequency around menopause. Half of women aged 55 and older suffer 1 or more of the pelvic floor problems and conditions. If you are experiencing urine leakage, or feeling a bulge, or rushing to the bathroom and barely making it, having a sense of incomplete emptying, this is not normal. All these are treatable medical conditions. Start by talking about it with your provider and see a urogynecologist for further testing. Pelvic floor disorders, unfortunately, have a significant negative effect on quality of life if untreated. From avoidance of social activities, avoiding exercise, decreased sense of well-being. The great news is that pelvic floor disorders are very much treatable. Many advancements and understanding the conditions have led to effective therapies with really awesome results. In our patient-centered care model, women get to choose the treatment that fits their needs. All women who seek urogynecologic care should expect a significant improvement in their condition, and for most, a full and long-lasting cure. While there are some risk factors that cannot be changed, like family history, genetics, childbirth, there are many preventative measures that improve the pelvic floor health, such as pelvic floor muscle exercise, otherwise known as Kegels. If they are performed regularly, starting at a young age, they can actually prevent urinary incontinence and improve symptoms of prolapse. Healthy lifestyle and exercise to avoid excessive weight gain and keep the muscles in good shape is another good strategy. Very important is to avoid constipation by having a high fiber diet and adequate fluid intake. I also always advise women to avoid repetitive heavy lifting and learn how to lift safely with their legs. A better quality of life is just a few steps away. Thank you for watching this edition of Taboo Topics.